last year, it was still high. It was actually in high risk. Oh no, size limit reached. New video started. It's still counting. I don't know why I said that. So it was still high. It was in the high risk. And I'm like, ugh. But we made a lot of different changes with our diet, like doing more like not processed foods. And I think that made a huge difference. And then like changing the way I work out. But you know what I was also thinking? Stress increases cholesterol. And my daddy in my life right now. And that is decreasing so much stress for me. So maybe that has to do with it. And just saying, if you want story time on that, let me know. But feeling good about that. I'm in like the border line, but it's getting lower. So I feel like that's good. Maybe I should just do more. Like I know we've kind of been slacking on eating like the unprocessed food a little bit. Overall, not eating processed foods really. Even my peanut butter is natural peanut butter. Trying to have more balanced meals. But there are, obviously some days where we eat food that it has processed stuff in it. But coming back on that as much as possible. But other than that, you guys know I have PCOS and my A1C is excellent. I don't know if I ever told you guys, but I also have a paractoloma. So that's a little tumor that's where they're is it a paractoloma? Your gland that secretes prolactin and other hormones. Why am I blanking on the name? But anyways, my prolactin levels were very high, like in the 30s, and now it's 8. So I have to take a pill twice a week, and the hardest part about this is remembering to take a pill twice a week, because it's like, okay, I will take it on Friday, and then I will take it on Wednesday? I don't know. I mix it up all the time. I just took it on Monday, so hopefully I remember to... Was it Monday? It was Monday. So hopefully I remember to take it like Friday. I don't know. Something like that. And either remember to take it either tomorrow or Friday. I think that would be best. It's just always hard to remember. And then my thyroid looks good too. So that's great. We're still waiting on like my vitamin D. And I can't remember anything else. There could be other stuff. I don't know. But looking okay. And so we talked to the doctor on Monday. And we got the go-ahead to up my progesterone because we're only on 200 milligrams and this once per day. And she said we could do 2 of those, so 1 in the morning and 1 at night, which I feel better about. I did have like a chemical pregnancy a couple months ago, and like, I don't know, it could have just been my body rejecting it, but I wonder if I had the right amount of progesterone, if that would have helped. I don't know. So we are mid-cycle right now, if you did not know. Now you know. We got the triggers, and we were just waiting. Oh, storage is almost full, so I'll give you guys another update soon. I think. Alright, let's do a little math talk. So, more of the TTC journey, I think. I got a bunch of blood tests today. Let me tell you, the place that I typically go to when I'm not at the clinic, they know me now. She was literally standing at the door when I went to go in. Like, they have a little doorbell that you ring to let them know that you're there. And I was walking up to ring the doorbell, and she's just standing there, and there's a window in the door, and you could see her, and she opens the door, and she's like, "You here for a blood test?" And it's like, obviously, yes, I am here for that. And she goes, "Were you, like, just here?" Mind you, I wasn't just there. It was, like, a few months ago that I was there, so not that long. like, come on, girl. But she's funny, and she always gets my blood to draw pretty quick. She's pretty good. I mean, they use different kind of needles at that blood draw place than they do at the clinic, which I don't know. I find that interesting. But I had to get 6 files done today. I believe it was 6. Last time I had to do a lot of different tests. They did 12 vials, so I was happy that it was only 6. But I had to get my infectious disease one redone. It's been a year, and I guess they like to keep that up to date. Which we're all good, obviously. There's been no weird things happening. I mean, I guess there's always that possibility because you're going to like the clinic, and who knows what's happening with people? Who knows how good they're cleaning shit? You know, be careful. But that went good, and then we haven't gotten all the panels back, but we got some important ones back, like my cholesterol. So I was told, it's like 21 or 22, that I had high cholesterol, or just like borderline of high cholesterol. And I was like, what is this? Like, blah, blah, blah. And my doctor at the time was just like, well, here's a pill. Like, didn't actually talk to me about it. He just put in an order to my pharmacy and just expected me to start taking this pill without even talking to me. And then when I went in the follow-up, he was literally like, why haven't you started taking your pill? I was like, because nobody talked to me about it? Maybe we should see what the patient wants to do? I don't know. And then he was like, well, you don't want to take the pill? And I was like, no, I'm in my early 20s or mid 20s. I forget how old I was. And I don't want to take a daily pill for the rest of my life. And he was like, oh, well, you can try lifestyle changes. And the lifestyle changes he suggested were exercising, not eating fast food, and not eating fried food. Sir, I exercise 5 times a week. I barely ever eat fast food. And I maybe could cut down on some fried food, but I also don't eat a lot of that. So I'm like, whoa. And then when I got it retested,